Nice. So get ready for this one. Because today we're diving into something that just might make you rethink like a lot of what we thought we knew about sports medicine.
Oh, yeah.
Cryotherapy.
Always a fun one.
It is. And we're doing this one because a listener sent in this really fascinating research paper.
Yeah.
It's called Cryotherapy for Treating Soft Tissue Injuries in Sport Medicine, a critical review.
Right.
And while it seems like we need to have a serious talk about ice and like how well it actually works for healing those sports injuries.
Definitely. I mean, this
Okay.
paper, which, by the way, was just published last August in the British Journal of Sports Medicine.
Oh, wow. So recent.
Yeah, it really dives deep into like decades of research on cryotherapy. And what it found is kind of mind-blowing, honestly.
Yeah, well, and it makes you think twice about like the whole RICE protocol,
Yeah.
rest, ice, compression, elevation.
Yeah.
I mean, it practically drilled into our heads from the moment we start playing sports, right?
Silly.
Like, I don't know about you, but I've definitely reached for that ice pack more times than I can count after twisting an ankle or, pulling a hamstring.
Of course.
It just feels like the right thing to do.
It's almost instinct.
Exactly.
You want to reduce that inflammation,
Yeah.
take the pain down a notch,
Yeah.
and of course, speed up the healing process.
Right, exactly. So where does this research fit into all of that?
Well, that's where things get really interesting because there's a pretty big gap between what we've always thought about cryotherapy and what the science is actually telling us.
Okay, so let's break this down. We're talking about like hard evidence here, right?
Exactly.
What does the research actually say about using ice for these types of injuries? Yeah.
There's actually very little scientific proof that cryotherapy does much beyond just managing pain, especially when it comes to actually healing the tissue damage in humans.
Wait, are you serious? Are you saying that all those years of icing our injuries could have been for nothing?
I wouldn't say nothing. Pain relief is definitely a real benefit of cryotherapy, at least right after the injury happens,
Okay.
like those first few hours. But this idea that it actually helps you recover faster, that's the part we're going to dig into today.
Okay, so if the research on humans is so limited, where is all this belief in cryotherapy coming from? Like, haven't there been a ton of studies on this?
There have been, but a lot of them have been animal studies, not human trials.
Okay.
And that's where things get a little tricky.
Right, because a lab rat isn't exactly the same as a person, is it?
Exactly. It's not a perfect comparison. A muscle strain that we create in a lab setting isn't always going to be the same as like a sprained ankle you get playing basketball.
Yeah, that makes sense. So what are these animal studies actually showing then? Are they seeing positive results with cryotherapy or not?
Well, that's just it. The results are mixed, and we really need to unpack this carefully. Some studies actually suggest that cryotherapy might slow down the healing process.
Wait, really?
Yeah, particularly when it comes to those more severe muscle injuries.
Hold on, slow down healing. How does that even happen? I thought ice was supposed to help.
It all comes down to your body's natural inflammatory response. You see, when you get hurt, that initial inflammation, it's actually a good thing.
Oh, really?
It's your body's way of sending in like a cleanup crew to deal with the damage and start rebuilding.
So it's like telling those construction workers to take a break after they just showed up with all their equipment.
Yeah.
It's very helpful.
Not at all. And while cryotherapy can be great for numbing the pain in some cases, it also seems to be suppressing those same inflammatory processes.
Oh, wow.
And those are the processes that are key for your body to heal properly, especially in those early stages.
So what does this mean for athletes? Should we just like ditch our ice packs entirely?
Well, it's not quite that simple. And that's where the whole lack of human studies thing really comes in.
Okay.
We know from experience, right, that cryotherapy can be really effective for pain and swelling, especially immediately after an injury happens.
Right.
It's the long-term effects on the actual healing that we're still figuring out.
So maybe like a little bit of ice in those first few hours after an injury, just to take the edge off.
Yeah.
But then after that, just let your body do its thing.
That's kind of the general idea, but you have to remember, we're dealing with a lot of unknowns here.
Right.
What works best for one person might be totally different for someone else.
Of course.
It all depends on the injury, how bad it is the athlete themselves, a ton of things.
That makes sense. What about tendon and ligament injuries, though?
Oh, yeah, those are tricky.
Those always seem to take forever to heal.
They do. And unfortunately, the research on cryotherapy for tendons and ligaments is even more limited than for muscles.
Really?
Oh, yeah.
Yeah.
We're talking like almost no human studies to go on. And even the animal studies we do have are all over the place.
So are we basically in the dark then when it comes to icing those kinds of injuries?
Not completely.
Yeah.
We can still learn something from the research, even if it's not perfect.
Okay.
Like one animal study found that cryotherapy actually seemed to reduce certain chemicals
Yeah.
that are linked to pain signaling in tendons.
Interesting. But like you said, it's just one study.
Exactly.
We need a lot more data before we can really say for sure.
We do.
So what's an athlete supposed to do in the meantime? Just play it by ear or stick with the RICE protocol just because it's what we've always done?
I wouldn't say that either. I think even though we don't have all the answers yet, there are still some practical things you can do.
Like what?
Well, first and foremost, listen to your body.
Okay.
If something hurts, don't push it.
Yeah. Good advice in general, I think.
Always.
Yeah.
And then when you're dealing with an acute injury, those first few hours are crucial. Trying some ice in those early stages might help with pain and maybe some of that initial swelling too.
So a little strategic icing could be helpful.
It could be.
Hmm.
But the key word there is strategic. Don't go crazy with the ice baths and frozen peas.
Right. Moderation.
Exactly.
Hmm.
We want to support your body's natural healing process, not stop it completely.
Right. Of course.
Yeah.
And I mean, it probably goes without saying, but if you have a really serious injury
Oh, definitely.
or you just aren't sure what to do, always talk to a doctor.
Absolutely.
Someone who's up to date on all the latest research can give you the best advice.
Exactly. They can help you make the right decisions for your specific situation.
This whole conversation has really made me think, it makes you wonder what other stuff we just kind of take for granted in sports medicine.
Right.
Even just in general health,
Totally.
That maybe needs a second look.
It's so true. Like, as we do more research and learn more about how our bodies heal,
Yeah.
we're bound to find even more surprises, just like this one.
Right.
It really shows you how important it is to keep asking questions
Definitely.
and not be afraid to challenge those old beliefs, even when they seem like common sense.
Absolutely. And I think it also just really highlights how amazing our bodies are
Oh, for sure.
at healing themselves. I mean,
Amazing.
when we give them what they need, of course.
All right.
Like maybe sometimes the best thing we can do is just step back and let our bodies do their thing.
It's true. Sometimes the simplest approach is the best one.
Exactly.
Yeah.
Well said. Well, this has been a fascinating look at cryotherapy and how it affects recovery from sports injuries.
It really has.
And while we definitely still have a lot to learn,
No.
I think by asking these tough questions
Yeah.
and staying informed,
Exactly.
we can all make smarter choices about our health.
Absolutely. And who knows, maybe this conversation will even spark some new research.
Oh, that would be awesome.
Yeah. And then maybe we'll have even better treatments for sports injuries in the future.
Yeah, that's something I'm excited about. Well, that's about all the time we have for today's deep dive.
This is great.
Thanks for joining us as we explored all things cryotherapy.
Yeah, thanks for having me.
Until next time, stay curious and take care of yourselves.